Welcome to Spilling the Tea on Burnout. This podcast dismantles the myths surrounding the causes of burnout, caregiver fatigue, and moral distress, and dives into the many layers that keep us stuck in cycles of shame, self-blame, and eating our young. We are bringing humanity back into healthcare. You are not broken. You are not meant to push through. Suffering is not a badge of honor. This system was designed to chew you up, spit you out, and move on to the next new grad. We've all seen it, we've all experienced it. We explore how systems and culture betray us and how rediscovering your intuition, body, and building community can become a radical act of resistance and change. This podcast is hosted by Doris Taylor, a nurse who worked in corporate healthcare for 20 years before quitting her career and now works as a burnout recovery specialist, creating community and guiding nurses into sustained burnout recovery. In today's episode, we are talking about immigrant rights training for healthcare workers with Jamey, who is a Minneapolis healthcare worker and national organizer. And today I'm drinking Earl Grey tea because it's early in the morning when we're recording the session. Welcome, Jamey. Do you want to introduce yourself?
Yeah, thank you so much for having me, Doris. It's a real honor to be here. My name's Jamey. I use he, him pronouns. And I'm a medical student from Minneapolis. Before that, I worked on an ambulance in rural Minnesota for 4 or 5 years. And before that, worked in incarcerated settings, working with healthcare with people who were in the system. And I'm training to be an emergency room doctor. But I think I'm mainly here today to talk about my role as a healthcare worker in Minneapolis during this past winter's Operation Metro Surge, which was the unprecedented surge in immigration enforcement that came to Minneapolis, both on the streets and in our hospitals and in our schools, and talk a little bit about our work now touring the country to share what happened and prepare nurses and doctors and techs and residents and everyone else in the healthcare system for what could be coming to your city soon.
So, Jamey, tell us a little bit more about how these trainings came about. Like, was there already kind of a structure that had been set about talking about immigrant rights training for healthcare workers, or like in the moment, was it, oh, was there a huge need identified and then it was created kind of in the moment during the surge?
It's a really good question. So in January of 2025, so let's like zoom back, almost a year and a half, right when the second Trump administration took office, they very quickly released an executive order where they got rid of a sensitive space memorandum. And essentially what that was is they very explicitly, they went on TV and said that we're no longer going to be telling ICE to avoid schools, places of worship, or hospitals or healthcare spaces. And when that happened, there was a little bit of like online kind of discussion, and on social media groups started posting about it and what to do. So I ended up actually bringing some just like very very kind of vanilla, vague, but vetted like ACLU know your rights resources to my hospital, and I put them in the provider workrooms and some of the nursing stations. And within like 4 hours of doing so, I had like 5 missed calls from the executive team of my hospital that I was working at. And I had to get called in for discipline. And the first thing they asked me was who I was working for. They thought I was planted. And once it seemed like this was kind of a good faith effort, they explained to me that you seem to be trying to help your patients, but what you're missing here is that if we as a hospital, and mind you, I was working at the largest safety net hospital in the Midwest. So this is a hospital that primarily serves immigrants, people who are uninsured, underinsured. And they explained to me that if we do anything to prepare our staff or say anything about ICE or do anything publicly or even privately, the administration might find out and then they're going to cut our funding and we'll have to shut down as a hospital. So therefore, we're not going to do anything. We can't do anything. Our hands are tied. And to me, that was a smoking gun that there were no adults in the room. Mom and dad were no longer home. Our hospital was going to do absolutely nothing. Our city was going to do absolutely nothing to prepare for what to us was a very credible threat to our patients. So me and a couple of ER nurses, one at the hospital I was working at and one at the other large trauma center across town, teamed up and started putting on these, we called them healthcare worker resistance trainings to start in the community, where we did our own research and talked to lawyers and talked to people across the country and built best practices on really what we're supposed to do to serve immigrant patients during this unprecedented time, and also what to do when they're being brought in if they're detained. And we started doing these trainings, and from the beginning, they were very well attended. And before Operation Metro Surge, so between, I think our first training was March 2025, and I guess our last training before the surge was actually and I can talk more about this later, but in an attending ER doctor's living room on December 5th. But between that time, we trained over 600 frontline healthcare workers on what to do. And then once Metro Surge started, we had an immense increase in demand. And I think we trained about 500 more people during that time. And these were all in community centers, churches, living rooms, Zoom, you name it, parks. And this was all healthcare workers knowing that their hospitals either were not telling them what to do or were lying to them about what to do, and them just knowing that they needed to know what was the right thing to do, not just ethically, but legally. And that's kind of how these trainings were born.
And so could you let's kind of reintroduce what we're talking about. So we're talking about trainings for healthcare workers on how to protect the rights of patients and staff when working in the presence of ICE. And the trainings that you're doing have prepared over 1,000 frontline workers in Minneapolis to respond during Operation Metro Surge. And now you're taking these trainings on the road. We're talking because you reached out. I live in the Pacific Northwest, and you're bringing these trainings to the Pacific Northwest. And where else have you been? Is this the first area that you're coming to? Have you been doing trainings elsewhere in the country?
Yeah, that's a great question. So during the surge, we started having people reach out from all over the country asking for trainings or for Zoom sessions. And I've talked to people from all the way from Boston to San Francisco online. And then once things started to settle down in Minneapolis, and it started to seem like this was going to start happening in other cities around the country, and that other cities were looking for more preparation, we decided to put together a bit of a tour. I don't know if people remember, but before Minneapolis, Chicago was I think they call it Operation Midway Blitz. I don't know
Yeah.
who in the Trump administration comes up with the names, made for TV, but they came to Chicago, and I want to say it was summer 2025. And after that, the good people of Chicago went on tour and went around and trained everyone up on how to prepare, including us in Minneapolis. And I think we're kind of trying to return that favor now. And we already did a tour in the Great Plains, where I went to Kansas City, Iowa, and Omaha, and met some really, that was really impressive, because these are healthcare workers in very conservative spaces where it was illegal and very much a lot more dangerous socially to be standing up for these issues versus in places like Minneapolis or now the Pacific Northwest, where I'm going to be heading in just a couple weeks. So I'll be in Seattle on August 24th, Tacoma August 25th, Portland on the 26th, and Eugene on the 27th. And it's just a different it's a different calculus. I think when you're in cities or states that are perhaps more blue in their political leanings, as we found in Minneapolis, you have the people in the community really believe and stand up for these things, but where we really struggled was our institutions and our politicians, right? When it came to the rubber hitting the road, if they were really going to stand up for folks or if they were just going to try to maintain the status quo. So I think, I'm really excited, and I've already been connecting with a number of groups in the Pacific Northwest getting ready for this tour, but I'm excited to meet with, individual healthcare workers and hear about what's been happening up there. Because I know ICE is there, and I know that actually right now it's probably as bad as it's been for y'all. And I've been doing a lot of reading about the detention center in Tacoma and what's happening at St. Joe's Hospital in Tacoma and what's happening at Harborview in Seattle. But I'm very much looking forward to kind of helping y'all and learning more about just the unique power dynamics that are at play up there.
Yeah, we've definitely, because we had the World Cup here in June, July, and there was definitely a surge before the World Cup. There was a lot more abductions at that time, and then since mid-July, there's been definitely a ramp up of activity that everyone's noticing. I'm not sure how that's always playing out in the healthcare setting, like in ERs. But I did hear, well, it was on the news a while ago about how, because like St. Joe's in Tacoma, they're contracted with the detention center, about how an ICE agent left a loaded gun in a bathroom, like a public restroom. And it was found by, environmental services. And so I'm
Crazy.
wondering if
That's
you
absolutely
could talk,
nuts.
could talk a little bit about how or who do you think is most impacted? Is it more just ERs? Or when this was occurring in Minneapolis, were they going on the floors? Like um, who do you think would benefit the most from these trainings?
Yeah, that's a really good question. I think that for a lot of healthcare workers, it's really abstract until they experience it. And then when they experience it, they're like, what do we even do?
Mhm.
But really, when there is a big ICE presence in your city, in particular, well, I kind of have two answers to this question. And I'll start with kind of the more straightforward one. You're mainly going to see it in your emergency departments and your inpatient hospital wards. Um, for two different reasons. Um, the first is that when they start arresting mass numbers of people, which they're doing all over the country right now, and if they were to do a surge in your city, which we do think there's going to be another surge soon, we just don't know exactly where. But if they were to do a surge in your city like Minneapolis, we were seeing up to 100 arrests per day. That's an incredibly large number of people. And the other thing you need to keep in mind is that in ICE detention, there is zero healthcare services. They don't even offer medications. So if you're a healthcare worker, you can imagine if you're getting arrested and you're type 1 diabetic, if you have some kind of a heart condition where you require medications, if you have a kidney condition where you need diuresis, you name it. Pretty quickly, these things aren't going to be able to compensate in the detention center, especially a place where bodies are experiencing immense stress, not getting sleep, not having a lot of space. On top of that, there's high infectious disease burden in detention spaces because of the PAC conditions. Long story short, you have a lot more people getting sick. So those people need to be brought in by ICE to the ERs. And we want them to bring them into the ERs, right? Hospitals are unique. This isn't an ICE out situation because if we're ICE out in the hospitals, that means that people in detention aren't getting brought in for care. So the question isn't if ICE should be in hospitals, it's how they should be in hospitals. On the flip side, with that same scenario, with a surge or with an increase in arrests, you're gonna see it. And this is not hypothetical anymore. This is proven all over the country and in Minneapolis. You are going to see more brutality. And during Operation Metro Surge, about half of the patients being brought in were people who had gotten beat up during arrests. And it was anywhere from minor assault to people who were brought in unconscious with multiple skull fractures, intracranial bleeding, rib fractures. And the ICE agents told the doctors and nurses in the stabilization bay that the person just ran into a wall. Um, these are true stories. Imagine being in the resus bay and having someone brought in that condition, having to get imminent intubation, fast exam, CT scan, pan scan, and you're being told by four dudes with long guns with masks on their face that this person just hurt themselves. This is what
Like
happened
they,
in Minneapolis, and that's why we're doing these trainings.
mm,
The flip side is when this stuff happens in hospitals anywhere, and now it's televised and also the communities talk, what ends up happening is people stop seeking health care. People stop leaving their homes altogether. But people are afraid to go seek health care because it's no longer a safe space. And if they find out that hospitals are colluding with ICE, which they are, and if they find out that, you know, they aren't making policies that will protect them, which that is what's happening, it's a very reasonable decision to prolong seeking health care. So what we see nationwide is we see increased time to presentation, which leads to increase in acuity. We see people not going to their primary care visits. We see pediatric visits getting skipped, people not getting their vaccines as a result. We see people laboring at home. We had babies born on the curb of the emergency department. Um, these are things that affect every single healthcare provider. So our training, over time, at first, we actually thought ICE would be raiding hospitals. We thought they were just going to be coming in and trying to steal our patients. And what we quickly realized is that wasn't happening. And our trainings have evolved over time to not only include really the main situation that's happening is ICE bringing people in, and what to do about it, but also to evolve to ask the question, how do we prepare our healthcare system, prepare our patients? How do we reach our patients who aren't coming in? So that way our whole healthcare system doesn't collapse. Um, I think it is not embellishing to say that in Minneapolis, our healthcare system completely collapsed. And not just for immigrants, it was for everybody during this time of Operation Metro Surge.
yeah, what do you think has been, because Metro Surges, when did it officially kind of end, do you think?
That's a good question. So I think that it ended at kind of the official date. I want to say was like February 12th or 14th, and that's when Tom Homan came on and said that they were going to be pulling people out, pulling the troops out of Minneapolis. And I think that a misconception that people don't fully understand is that, and we're being given a lot of credit as Minneapolis citizens, that we drove ICE out and that we stood up and all that. And it's true that did happen, but really what ended up happening and what ended up um, kind of leading to ICE's mass departure of Minneapolis wasn't that. It was the fact that our politicians started playing along. Our politicians started letting ICE go into our jails and taking people. Our politicians started collaborating with ICE. They stopped really standing by the sanctuary rules that had been established by the electorate and by elected officials prior to Operation Metro Surge, um, which is really disappointing. And it's so I think to answer your question, and for people in Minneapolis, we're all I don't. uh, it's ambiguous because we still see people getting removed from our communities, and now really what we're seeing is much more insidious, quiet kidnapping that is much messier and harder to deal with. And even just like right now, though, ICE is still in the neighborhoods. I live in South Minneapolis, which is, my neighborhood, my block was like one of the epicenters of this kind of operation, and there's still ICE going around picking people up. So I think the surge, probably we could say ended in mid-February, but things really were slow to go back to normal, and people are still living with that kind of trauma. And I think probably in your language, it's similar to burnout, in that these things they don't they never get a good bookend. They never get a good bookend.
What do you think has been, even though it hasn't truly been, it's officially probably been 6 months, but, you know, still ongoing. What do you think has been kind of the long-term impacts for like the wider healthcare system? Because you had mentioned how people are not accessing it. Do you think that will continue where people will be afraid to access healthcare, or even, and I guess also on healthcare workers themselves? Like what do you think has changed because of the ice surge that happened in Minneapolis? Like,
I think that this is already a community that was hesitant and distrustful of healthcare for many good reasons. Prior to Metro Surge, this was a community that had a lot of barriers to access. And when I say this, I'm referring to just um, non-English speakers, people who are from different countries, but also it applies to people just with different skin colors, because as we know, ICE was not just targeting people who were not U.S. citizens. They were racially profiling.
mhm.
Um, and I think that seeing our hospital systems collude with ICE, or perhaps collude's the wrong word, but not stand up to ICE, right? Really refuse to take a stand. And then also, another thing that really happened at a large scale was retaliation against healthcare workers who did stand up for their patients' rights. And I want to make it very clear, it wasn't ICE that was retaliating against the healthcare workers. It was the hospitals. And that dynamic, and it's actually a phrase that's been coined as a term called anticipatory obedience.
Mhm.
And the hospitals, they were never asked by the Trump administration, the Trump administration has never reached out to these hospitals, or really any hospital for that matter, and told them to comply with ICE. What the hospitals did is they did what this dictator, what the fascist administration wants them to do without even being asked to do it. They kind of complied in advance because of some kind of a fear, of what might happen in this hypothetical world if they didn't comply. And of course, part of that calculus is knowing that the people whose rights that they're encroaching on by complying in advance, the people who they're going to inevitably wrong, both ethically and legally, right? Don't have the privilege or the money or the support to sue them, or to make some kind of a big dent, in their budget or in their reputation. And that's where I think these county hospitals, safety net hospitals, are particularly vulnerable to this calculus of, we kind of call it like a currency of worthiness, and this kind of gambling that essentially hospital systems know that these folks can't sue them, and we might lose a couple of our patients. They might get deported, or they might get beat up, or they might get their right, HIPAA, or these certain things that, and we know how seriously our hospital systems take all of these things for other patients, right? Like, hospital systems will fire a healthcare worker for breaking HIPAA, but oh, the ICE agents break HIPAA like 30 times in an hour. oh, but we're going to punish the healthcare worker for trying to do something about it. And it's just because they know that they're more afraid of the federal government than they are of us and than they are of our patients. And and that's anticipatory obedience. And I think that that's led to distrust between healthcare workers and their administration. It's led to distrust between the communities and our hospitals. And I think this is a dent that we are going to be having to fight against for years to come. I think let's remember far, far, far back to 2020, right? And back when everyone cared about police and cops and healthcare and all that. And, I think it was funny. I always thought it was funny. At that time, you'd be on the radio and we were wondering why weren't certain populations getting their COVID vaccines? And, people they'd be bringing these historians on to talk about the Tuskegee experiments and these horrible things that happened, however many years ago. But it's like, this is happening right now. Like these are unsafe places for large groups of our society to go because of what our hospitals think is legal discrimination. And that's going to that's going to have long-lasting impacts in our society.
Yeah, I can see how that would, I mean, it just deepens that divide within those populations of like, oh yeah, we thought we had built some sort of trust with these hospital systems, but now not only is that trust broken again, but it feels as if that trust is broken even worse than what it was before. Um,
Yeah,
and
unfortunately.
I just wonder how how performative, in 5, 10 years it'll be of like these hospital administrations of feeling like they can perform some sort of repair and things will be fine, and then be like, I don't know why these populations aren't accessing healthcare and they're having increased risk and morbidities, and then of course blame the population for having these health issues, but then not truly trying to make a repair and accountability for what they did. Like this isn't from the 1950s. It is 2026, and it feels as I, and it just feels like I just have a hard time with hospital administrations who are performative in how they interact with certain populations, and then they will put the onus on making repair onto the nurses or the doctors, like as if we should make that repair with this population when we didn't cause this repair. And it really sounds also like there's a break of trust for the healthcare worker with the facility that you're working at too.
Yeah, there's so many breaking of trust, like you said. It's a shattering, I think, is really the truth. And, you know, how do we come back from that, to kind of continue the conversation here? And I think that's what this tour is about. And that's kind of my biggest lesson from all of this. And I don't want to get too into my situation, but I've faced immense retaliation for for what happened during MetroSurge and similar situations prior to MetroSurge with standing up to law enforcement and hospitals to a point where my careers is very it's completely changed. I've had to change career paths. And I think that what the thing that has held me and the thing that has, and not just me, but my patients and my community, has been community solidarity. And I think that what's really interesting about, at least me as a healthcare worker, that I learned was that when the worst imaginable thing happened, that kind of worst case scenario, that plan B, when all of a sudden, that risk that you took, that advocacy that you participated in, led to, in my case, immense disciplining and essentially for loss of employment. The community was there to stand up for me and catch me. And I think that that's something that is very central in communities that are constantly facing oppression. It's something that I think, like me as a white person who grew up in the suburbs, wasn't raised on. And I think that it's knowing that, yes, this situation is unique in how our institutions are currently, like this metastasis of this underlying cancer is a unique disease, right? But the underlying struggle and the survival of, it seems new to me, but it's something that people have been doing for hundreds of years. And and I think tapping into that, not only that history of resistance, but that history of survival and that history of solidarity and that history of standing up for people and being there to catch them. Because I think right now this isn't 2020 anymore, where we're going to get points. We're not going to get points for our careers by saying or doing some kind of social justice oriented nonsense. This is the time where we're going to take hits and where people are going to have to take hits in order for our people to get health care, in order for our people to get housing, for our people to get education. And and I think the question is not, do we take those hits, or what if we take those hits, but it's how do we take those hits and how do we support each other during that. And that's both for people who are taking hits and getting detained and getting um, having their families torn apart and um, possibly even being brutalized or injured. But it's also, how do we protect the people who are taking hits because they're standing up and doing something to protect those folks. Um, and I think that that's heavy to talk about, but it also, in many ways, is very liberating in that, instead of this kind of risk averse insurance kind of approach where we're trying to imagine what might happen to us, it's more focused on just being in community and being together.
Well, and I think uh, you know, that's one of my biggest pushes is to change and create community within healthcare, because we've I don't know how much we've actually ever had, but it's how we're going to get through the breakdown and the fall of our healthcare system is by coming together as, not just say the nurses in an ER, or like I worked med surg, nurses on a certain floor, but how to bring people across a facility together. And, here in Seattle, a friend and I have started doing Nurse Connect events. So we meet once a month at a local bar and for a couple hours just to bring people across the Seattle area together, just to hang out for a couple hours and talk. It's not there for trauma dumping, but it's a way to create some connection across fields and across the hospital systems, or in the different facilities that people might work in, because we don't have that sense of community and coming together. And we don't know what's going on in another facility, in another area, right? Like we don't know what's going on and school nurses or community health nursing. And that is so important right now, because we need to know what's going on and be able to come together and support each other in way different means than we've ever probably done before. And I think as our healthcare system essentially crumbles and becomes more corporatized, and you have all these private equity firms coming in and buying healthcare facilities, like we need to be able to come together and support each other, and then support the people who are like support and train more activists within the space, because I firmly believe, like, if you work in healthcare, it's all political, right? Like, you're dealing with populations who are most impacted by the policies that are enacted politically. And like, how can you not see those connections between the patients you take care of and how the system impacts those populations and doesn't support them, but also doesn't support us inherently either? Because if you're able to be terminated and targeted from positions for even just speaking up, like, that's a problem, because nothing's going to change if we can't speak up and we don't feel empowered to speak up, not even just as an individual, but if there's 20 people that show up at, the hospital I used to work at here in Seattle, the pediatric hospital, they would have these town halls with the CEO, and all the questions were like pre-screened, right? Like, so they're already, it's it's not an open discussion about the real issues of what's going on and what you see in your job. It is these pre-filtered questions that are like softball questions. And that's not how change happens, and that's not how we truly support each other, by not being able to to speak out and talk to the real issues that's going on and what is truly impacting our patients and ourselves. Um, and so being able to even just think about how to develop community differently and see learn from populations that have been colonized and have felt that impact and feel it today, right? Like, it hasn't changed, but we, I think, as a lot of white healthcare workers, we haven't had to feel that pressure and um that pain. And I feel we're kind of coming to a head, essentially, as to we need to learn how to organize and support each other, like, quickly, and come together in order to, like, not just survive these next 6 months, this next year, this next 5, 10 years, but uh but build something differently so we don't keep repeating these same patterns.
Totally. And like, I think that like some threads that I was picking up on when you were talking to is like this needs to be an interdisciplinary like battle, like this is something we need to do together, not just as nurses, not just as doctors, not just as residents, not just as techs. It needs to be an interdisciplinary cross union, right? We need union collaboration with each other. Also, if people aren't organized yet, they need to get organized. And I'm mainly looking at my doctor homies. Um, and and I think that like events like the one that we're putting on in Seattle and Tacoma, um, is even though that I think right now the focus is on a specific issue that's in front of us. I think bringing these folks together to start working together to start organizing is what really led to some really amazing relationships and outcomes in Minneapolis. And our hope is that, you know, like none of this is just about ICE. I want to make that very clear. Like I kind of said earlier, ICE is just the current metastases of like this very malignant underlying disease of racism, of discrimination, of police in healthcare settings, of retaliation against healthcare workers, of patient-centered care, right? And to discipline when people do that. Corporate healthcare, the battle against corporate healthcare, and I think that it is time for us to come together. And we've done this training, and we've had rooms full of with surgeons, nurses, ER doctors, harm reductionists, street outreach workers, social workers, all in the same room. And the magic that happens when that occurs is unbelievable. And part of who that includes is not just the people who are, active in the DSA or active in, people like me who've been doing criminal justice work for years. Like, we're not just looking to get the organizers out. What we found is that just the everyday healthcare worker, the folks who are passionate about just doing their job well, who maybe aren't political, so to speak, right? Well, we're all political, but the ones who aren't necessarily politically organized or involved, they're the most important people to come out to events like this. In Minneapolis, I'll never forget, like, I unfortunately, once horrible things started going down, my work changed from proactive work to responsive work. And I would get calls from nurses who somehow got my phone number at 2 in the morning, crying, I don't know what to do. There's 4 armed ICE agents in this room right now with me. My patient's not getting the care they need because of it. I don't know what to do. And I had, every day, I don't want to make a stereotype here, but imagine you're just everyday bread and butter nurse on a med surg floor in Minneapolis, Minnesota, like all the barbs and the patties and, you know, and it was those people calling me and people who voted for Trump and people who said to me things like I could have never imagined doing something to get arrested. I always looked at protests and thought, oh, what's wrong with those people? And then they said, after this experience, I understand because something deep in all of us that go into these fields, we want to do what's right. We want to be able to serve people. And I think that that calculus of being able to both serve the institution and the state and serve your patients is getting tighter and tighter. And we want to talk to these folks before they end up in these horrible situations where they're by themselves. So I'm really excited to be coming and really appreciate you for having me on the podcast. And so that way we can try to reach just this broad audience and bring them in.
Yeah, I want to thank you for reaching out to me, and I'm glad we were able to connect and you tell your story and talk about the trainings and the significant impact that happened in Minneapolis and everywhere, right? Like it's not going away. And like you said, it's not just about ICE, it's about the system that we are currently living in and experiencing. And it's not like we're not going to go back to a time where healthcare are heroes again. We went from heroes to zeros pretty quickly, and I think it's just a kind of a downhill slide potentially, because of the way our healthcare system is continues to develop. And I think, re-emphasizing it's about community, it's about being able to come together, but also knowing what to do in case these things happen and how to recognize them, because it's we need to be prepared for the worst case scenario and start coming together and have these conversations. So I'm super excited that you're coming to Seattle. I will be there. I'm excited to meet you in person, and I will make sure that I have the link in the show notes for people to sign up and the dates and everything. And I am excited to be able to bring this to people, not just in the Seattle area, but also in the Pacific Northwest, because the dates are a couple weeks out, and hopefully people will be able to come in and really join and have a significant impact on how they view healthcare and the populations that they serve by coming to these trainings and be able to connect with people within these healthcare spaces differently. Because it's going to be a long haul, long fight. We have to look at the long arc of how we want healthcare to be different and then continue to fight for something different. So
Thanks,
thank you,
Doris.
Jamey, for coming on to the podcast. Is there anything else you would like to let people know, or any thoughts at
Yeah,
the end?
so I mean, so to summarize, I'll be coming into Seattle. I get in at like I'm taking an early flight, and I get in at 8 a.m. and I'm gonna go straight to Harborview on the 24th, and I'll be in the cafeteria with CIR, the Committee of Intern and Residents, tabling and going to workrooms from 11 to 1 at Harborview on the 24th. And then we have our community training from 7 to 9 p.m. And that's something you'll have to RSVP for, and then I'll send you the location, and Doris will post the flyer. We have a little QR code with a link tree that has all of these awesome resources too. If you can't make it, you can skim through those. And then the next day, we'll be going to St. Joe's in Tacoma to do some tabling around the lunch hour. And then we'll be having our event August 25th from 6 to 8 p.m. at a location in downtown Tacoma, which once again, if you RSVP, I can send you the location info. So yeah, I really can't wait to see all of you there and really to kind of continue the conversation in person. Thanks so much, Doris.
Thanks, Jamie.